Good to go. All right. You ready, Dr. Morrison? Yeah. Well, good afternoon, everyone. Welcome to our COVID briefing for today. Dr. Morrison will give us the most up-to-date information on the COVID situation in PEI, and we'll be here to answer questions after. So over to you, Dr. Morrison.
Good afternoon, and thank you for being here. It's the first day of school for 2021-22. My children asked me this morning, they heard me mention, I hope everything goes well this first day of school, and one of them asked me, do you mean for us or for everybody? And I said, well, for both, for you as well as everyone in PEI. So it's an exciting day for many PEI families, and some children starting school for the first time, and others transitioning to a new school, and others looking forward to a challenge of a new grade level. And I know while teachers, bus drivers, staff, and administrators share the excitement that comes with a new school year, it can also be a hectic and stressful time as course schedules, bus routes, lockers, and other administrative and classroom issues are addressed. So I wish all students, families, and staff a successful school year. It's my sincere hope that, similar to last year, students in PEI will benefit from a full year of in-class learning. Today, there are 2 new cases of COVID-19 to report in PEI. Both individuals are in their 20s. These individuals traveled outside of Atlantic Canada. Contact tracing is complete, and they are self-isolating. There are a number of flight notifications for these cases that will be posted on the website this afternoon. We currently have 5 active cases and have reported 235 cases since the pandemic began. Atlantic Canada reported 150 new cases in the past week, and there are currently 233 active cases in the region. Nationally, new cases are up 20% in the past week, with hospitalizations up 34% and ICU admissions up 29%, mostly among unvaccinated individuals. And this daily average of new cases in Canada is similar to the numbers in late May. New cases are highest in the 20 to 39-year-olds. Over 75% of the new cases are the Delta variant. Since December 14th, when the vaccine first became available, 89% of new reported cases were in unvaccinated individuals, and 1% of cases were in people who were fully vaccinated. The remaining cases have been in individuals who are partially vaccinated. The virus spreads more effectively and easily among individuals who are not vaccinated, and outbreaks are more common in areas where people are not fully vaccinated. The spread of COVID-19 in areas of low vaccine coverage presents a risk for emergence of and replacement by variants, including the risk of variants with the ability to evade vaccine protection. Recently, Dr. Theresa Tam, Chief Public Health Officer for Canada, released the latest modeling information for the country, predicting a strong resurgence of COVID-19 driven by the infectious Delta variant. Specifically, if the vaccine rate does not increase and more restrictive measures are not implemented, we could see up to 15,000 cases of COVID-19 per day in Canada by the end of September. The Delta variant-driven 4th wave will have greater impacts in terms of hospitalizations, ICU admissions, and deaths. Dr. Tam advised that in order to lower the predicted number of new cases, we need to do the following: immediately increase the vaccine uptake and close the protection gap in younger age groups, especially in those under age 40, and reduce contacts by at least 25%. Given the rapid spread of the Delta variant, our window of opportunity to slow the spread of this strain of COVID-19 is narrowing quickly. All models and indicators suggest the 4th wave will be a challenge to health systems across the country, and what COVID-19 will present to us in the fall is unpredictable. The message certainly is clear. Among island residents who are age 12 and over, we need as many of you as possible to be fully vaccinated. There are over 43,000 people in PEI who are not fully vaccinated. That includes 19,000 children under the age of 12 who are not eligible. As of Saturday, September 4th, a total of 244,813 doses of vaccine have been administered. 91.7% of the eligible population have received at least one dose of vaccine, and 82.4% of eligible island residents aged 12 and over have received 2 doses of vaccine. PEI is fortunate to have a high overall uptake in the eligible population. However, the rates of fully vaccinated people aged 12 to 40 is still less than 80%. The health PEI vaccine clinics are accepting walk-ins, meaning you do not need an appointment. Please check the provincial website or call the vaccine booking line to confirm the locations, dates, and times of the vaccine clinics before dropping in. The Charlottetown Vaccine Clinic that was at Eastlink Centre has now moved to the Sherwood Business Centre. Participating pharmacies continue to offer mRNA vaccine to individuals aged 18 and over. Again, please check the COVID vaccine webpage for the location of participating pharmacies and contact information. Over the next few weeks, UPI and Holland College are offering vaccine clinics on campus, and please check the respective post-secondary website for more information or call the health center on campus for more details. Our goal has not changed: to protect all eligible island residents with 2 doses of vaccine as soon as possible. We have received numerous questions regarding a booster or 3rd dose of vaccine for certain groups. The data is being reviewed by the National Advisory Committee on Immunization, and a recommendation is expected soon. In Canada, we are seeing some breakthrough cases in people who are fully vaccinated. A breakthrough case is when an individual who is fully vaccinated tests positive for COVID-19. However, being fully vaccinated decreases the likelihood of being hospitalized with COVID-19 and reduces the chance of spreading the virus to others. Individuals who are unvaccinated are 36 times more likely to be hospitalized compared to those who are fully vaccinated. When the Moving Forward Plan was released in May, we estimated moving to Step 5 on September 12th, when there would be an easing of all public health and travel measures. It was clear when our plan was released that progressing through the 5 steps in the reopening plan would be based on vaccine targets, as well as a low level of disease and controlled transmission of COVID-19 and PEI in Canada. But much has changed since the reopening plan was developed. The highly transmissible and virulent Delta variant has emerged as the dominant strain of COVID-19. In PEI, for instance, all cases with sequencing information since June 1st have been the Delta variant. The country is in the early stages of the 4th wave. The curve depicting new cases is rising sharply, and some have described it as almost going straight up. In PEI, we've had 27 cases since August the 1st, and we had no cases in July. We know that having 80% of the eligible population fully vaccinated is not sufficient to provide the herd protection against the Delta variant. And while there's no ideal target, we know we have to aim higher than 80%. Dr. Tam commented that we need to aim high for the stars, I think were her words, and get as close as possible to 100%. National modeling that suggests if we do not increase vaccine coverage and maintain some public health measures, we may soon experience up to the 15,000 cases per day. The dominance of the Delta variant as we are entering the fall season, when people spend more time indoors, highlights the need to maintain some public health measures and make indoor spaces as safe as possible. And similar to the rest of Canada, we have lower rates of full vaccination in the younger age groups. When the Moving Forward Plan was released, we could not have predicted that by early September, the Delta variant would be dominant and driving the 4th wave of this global pandemic in Canada. We previously announced that border and travel measures, including screening, testing, self-isolation for partially and unvaccinated travelers, and the PEI pass to verify vaccine status prior to travel, will remain in place until at least mid-October. Screening and testing at the points of entry allows for early detection of cases and prevents the importation of COVID-19. Based on the epidemiology of COVID-19 in the region and in the country, now is the time to stay the course with our current measures and continue to focus on limiting importation and containing transmission and PEI. Similar to some of the other jurisdictions in the country, PEI will be slowing our progression to Step 5 of the provincial reopening plan at this time. This means that current gathering limits of 100 indoors and 200 outdoors will remain in place after September 12th, and operational plans for businesses, organizations, and organizers of organized gatherings will continue to be required. Approval of operational plans for a single cohort is not required. Weddings and funerals can continue to have a maximum of 200 people, and the cohorts of 100 indoors and 200 outdoors will remain in place at this time. However, we know the Delta variant is a game changer, and our goal line is changing because the virus is changing. And as we have done throughout this pandemic, we'll continue to plan for what may happen and act quickly and react at the earliest sign that COVID-19 may be spreading in our province. It's important that we take steps to ensure our children remain in school, that businesses stay open, activities continue, and that our economy continues to function as normally as possible while we continue to navigate through COVID-19. The implementation of Phase 5 will be determined over the next couple of weeks as we determine the role of the proof of vaccine credential as part of that implementation and the opening of Phase 5. The proof of vaccine credential or vaccine passport will allow the events to get closer to maximum capacity at larger scale events. And then, although this is at an early stage, it's important to note that events or venues that use proof of vaccine credential may still be required to maintain other public health measures, such as cohorting. Having events where all attendees are fully vaccinated does lower the risk significantly. However, it does not make an event or venue on its own COVID-free. Regardless of proof of vaccine credential or other public health measures, it's important that each one of us consider our own risk level and what personal health practices we will follow based on our age and health, the level of disease in the community, and the setting or the venue. As of September 3rd, unvaccinated or partially vaccinated staff in long-term care facilities and licensed nursing homes and community care facilities throughout the province are required to be routinely tested for COVID-19. We know that residents in our care facilities, many of whom are seniors, are at high risk of serious outcomes from COVID-19. Testing of unvaccinated or partially vaccinated staff who have direct care responsibilities is another measure to protect our loved ones who reside in long-term care and community care facilities. The rapid test kits were delivered to each home on Thursday, and administrators and operators attended a virtual training session to learn how to use the kits and about reporting requirements. And thank you to the long-term care and community care facility operators and staff for their cooperation and support of this measure, which will provide an additional layer of protection for residents in care facilities. Children returning to school for in-class learning, it's an important milestone for our province. We'll be taking steps to continue to support our children in the education system. And I've said this before, but the best thing we can do to support our children to return to school as normally and safely as possible is the same thing we did last year to keep the number of cases of COVID-19 low in our province. If COVID-19 is not circulating in our community, it is not likely to affect our schools. And when we went back to school last year, although we didn't have the Delta variants at our borders, we certainly, this year, we have testing at our points of entry and we have vaccination in place. We do know that children can get COVID-19, including the Delta variant, and this variant is more transmissible even in children, though there is no evidence to suggest it causes more serious or prolonged illness in children. Children who get COVID-19 can also experience symptoms of post-COVID condition or long COVID. We've had a number of questions from parents and guardians regarding approval of a COVID-19 vaccine for children under the age of 12, and vaccine trials are underway. Authorization of vaccine use in children under age 12 is the responsibility of Health Canada, and I would not expect it will occur before late fall or early winter. Given that children under the age of 12 are not eligible to be vaccinated at this point, and the rate of full vaccination in the under 20 age group is less than 70%, it's important that we know the vaccine status of teachers and school staff. All K-12 schools in the province are required to submit information on the vaccine status of staff to our office this week. Some preliminary data has already been received by our office over the weekend, suggesting a high rate of vaccination among school staff. Beginning later this week, we will also launch a pilot project where easy-to-use self-test kits will be available to some island children. The pilot project will focus on rural communities, with kits being available for families in West Prince and Eastern and Southern Kings. The test will allow parents to conduct an at-home screening test for COVID-19 if their child is showing any symptoms. And more details, I hope we'll be able to release later this week. And almost at the end here, since June, we've received over 4,500 PEI pass applications and welcomed over 472,000 visitors to PEI. Individuals entering the province are screened when they enter PEI, and individuals arriving from outside Atlantic Canada, just as a reminder, are tested at the points of entry, along with unvaccinated individuals from within Atlantic Canada. A special thank you today to our border screening and testing staff. And I thought of you many times in the windy, rainy conditions we've had recently. And I know you've worked very hard in long hours in very unfavorable conditions in the past week. So thank you for your hard work and for doing your part to support the provincial COVID-19 response. We enter the fall season, I know, with some trepidation, knowing the modeling predicts potentially serious impacts from the fourth wave of COVID-19, and knowing this virus, as it's been all the way along, unpredictable. But we know that the very best thing we can do to protect ourselves and others is to be fully vaccinated. For individuals who are hesitant to get immunized, we know the benefits of being fully immunized far outweigh the risks. Please speak to a healthcare provider if you have any particular concerns about receiving the COVID-19 vaccine. I will note that Health PI reports that 99% of physicians at Health PI have received their first dose of vaccine, and 98% of them have received their second dose. For individuals who received one dose and do not have a second dose appointment, please make an appointment or drop into a vaccine clinic or a pharmacy. Until more people are fully immunized, Islanders should wait 14 days after their second dose before traveling outside the province. If you travel to another province, please wear a mask in indoor public places, follow public health measures in the area, and upon returning home here to PEI, get tested if you develop any COVID-19 symptoms. We know how to protect ourselves and others from COVID-19 and other respiratory illnesses. Same things we've been talking about for a year and a half. Cleaning and sanitizing, physical distancing, hand washing, masking in public places, limiting close contacts, and staying home when sick continue to be basic core measures we should be following. And I know I just mentioned entering the fall with some sense of trepidation, but I think it's a time of transition as well, and one of hope for our children and staff going back to school, and how despite a fourth wave feeling like it may be barreling towards us, we need to continue to keep Islanders safe, but at the same time continuing to get us back to as normal as possible in all that we do here in PEI. So as we continue this journey in this time of transition through COVID-19 together, let us continue to be patient and continue to be kind. Thank you.
Thank you very much, Dr. Morrison. I appreciate that. We will start our questions from the media, perhaps with those who are live with us here. So Brian Higgins, CBC, go ahead. Welcome.
So to be clear, is a vaccine passport coming to Prince Edward Island? And if so, when and what will it look like? How will it work? When will it arrive?
Well, I would say the first answer to that is I think we've had a vaccine passport from the beginning, essentially. I think our PEI pass has been working as a vaccine passport. And that has allowed us to maintain a level of security and safety here from COVID that perhaps other jurisdictions haven't been able to have. I think as we look to the future, we look to events getting, as Dr. Morrison has said, getting to max capacity or close to max capacity for the foreseeable future. I believe venues are going to need to demonstrate proof of vaccine. You said it a little bit more articulately than I have, but essentially, if I think in the foreseeable future in PEI, if you're looking to have large events and at a maximum capacity, you will be able to do that more so with those who are vaccinated than you would currently be able to do. So what it looks like, I think in the next 7 to 10 days or beyond, we'll probably be able to explain that in a little bit more detail, but it would be built upon the PEI pass that we have in place and trying to find a way to make that more maybe attachable to your phone and those types of things. So we want to make it as simple as possible for individuals to access and for those venues who host events to be able to verify. But I think, I think PEI will be like the rest of Canada and the world, really, that vaccine passports will be in our foreseeable future.
Follow-up question.
Sure. Did you need to add anything more to that, Dr. Moore? Or?
I think the Premier's outlined that very well. I think it's going to be part of that movement towards the Step 5 and the reopening to allow some of those events to higher risk events where there's more people to participate. And I think we'll certainly be speaking much more about it in the next couple of weeks.
In other provinces, we're hearing that you need a vaccine passport that will get you into private enterprise places, maybe a store or a pub or a bar. Listening to you today, it sounds like you're suggesting on PEI we're only going to be dealing with sort of larger mass gatherings, or could it come down to the retail level, so to speak?
I think at this point it's fair to say that I think we have a lot of policy work to do yet on this in this area, and that will be. The team is looking at the evidence, what's happening in other parts of the country, and so that decision really has not been made yet.
You have more? Go ahead. Yeah.
Is there a timeline attached to it? Any idea when we'll hear more?
I think, as we've been saying here, over the next 7 to 10 to 14 days, we have some groups within our midst who are working on what the bones of this could look like. At first, we'll need to come as a policy from CPHO, which I know they're working on developing of how it would work and what it needs to entail. But I think, before October gets too far in, that we would have something in place. Is that as firm of wishy-washy commitment as we can make on that? But I look as soon as possible, but very early into October would be our hope and goal.
And is a vaccine passport actually truly necessary? Because we have border controls. It's kind of unique in Atlantic Canada. It's very effective. There's no community spread. We all breathe a sigh of relief when once again we hear that they're travel related, they're self-isolating. Contacts tracing has been done. What further layer really can practically be added to an effective system already?
Well, I guess a couple of things. One, I share that relief, that sigh of relief every time we know that someone has been isolating and we're able to pick up, identify a case early. But I also know that we have some limited capacity at our points of entry, especially as we go into the winter for testing, and I think it's as we move towards a long-term in the next few months of what this could look like, I think this may be one additional measure that we can put in place, and we may not be able to have people at our points of entry forever, and so I think so there'll be certainly a transition period. I think we're looking at all the options at this point in time.
Yeah, and I think tremendous job of keeping Islanders safe. Islanders have worked so hard to keep themselves safe, and that's been a great success story here. We have, measures in place that have allowed us to maintain a higher quality of life for the most part through this pandemic than most. I think we're all uneasy when we hear about the Delta variant, when we hear about a fourth wave. It's startling for some. It was for me to find out when you hear it spelled out, as Dr. Morrison has, that 43,000 Islanders don't have a vaccine. That's, that seems like a big number. Now, I know there's 19,000, 12 and under who can't get one at this time, but still that's a higher number than would seem normal to me, for having all we've gone through here. So because of that, because there's still a limited capacity within our healthcare system and facilities to deal with an outbreak should it come, when you go to the hospital with COVID and you're not vaccinated, they don't treat you differently in there, but you might need more care and might have more strain on the system than we're able to deal with. And that's why we have to have these increased, levels of security in place. And we hope to not have them forever, but for the time being, that's the reality. And our primary job remains to keep Islanders as safe as we can keep them.
Question. So the passport, vaccine passport may replace border controls?
I'm not sure we'd say that yet. I think at this point in time, it's one additional measure that we need to be put in place, especially for higher risk type of events or larger scale events, to help businesses and organizations increase the capacity within those events. Right now, they're extremely limited in terms of the cohorts that are in place and the physical distancing. And this may allow some reduction in the physical distancing, still maintaining some cohorts, and increase the number of people who are in these venues. But there's no one's pulling out of the bridge at this point.
Thank you. Oh, thank you. Is it Steve?
Yes, hello to you both. We've heard from some travelers from outside Atlantic Canada that say they were not tested at the bridge, possibly because things were so busy there and they were trying to move things along. Can you clarify whether that has indeed been happening? If that's the process, that if it's particularly busy, you limit just how much testing you're doing at the bridge?
So I think we've answered that question a couple of times through certainly written responses too, but there have been very few occasions, and we have the documented times and places that those have occurred, particularly over like the long weekend in August, where there's we cannot have a lineup at that goes onto the bridge for safety's sake. So in order to to make sure it's safe for everybody, anyone who's not vaccinated, anyone who's partially vaccinated coming in from outside Atlantic Canada absolutely continues to be tested. But there would be some people for maybe an hour or two who were still screened and given advice, and then not tested because of some constraints. But then as soon as they are able to get through that particular lineup, then it would they'd be back to testing everyone, even fully vaccinated people from outside Atlantic Canada. And they always continue to test the people who are unvaccinated from within Atlantic Canada. So it when you think the airport is there's people there for every flight. And at the bridge, they're there 24 hours a day. The number of times they've had to go on to a sort of contingency plan has been very minimal since June the 27th. So, of course, we continue to do lots of testing, both PCR testing as well as point of entry testing. In fact, I think at the point of entry testing, we've done now over, I think it's 104,000 point of entry tests since we started, which is an incredible number of tests. So we've done almost 180,000 PCR-based tests, including 1,300 in the past week, which is up a few percent from the week before. And in the last week, we did almost 14,000 point-of-care rapid tests, which were completed. And we've done 104,100 point-of-care tests at our point of entry this summer. So which is a huge amount.
Canada opened its borders today to international vaccinated travelers. Can you lay out, I guess, what the rules are for those travelers coming to PEI now? And given everything that you talked about there, about the need to limit importation, how do you feel about international travelers coming to PEI?
Well, they will only be able to come to PI without isolating if they're fully vaccinated, and they will need to be tested like anyone else coming to PI. So they'll need their PI pass, they'll need to be tested, and if not, they will be isolating and followed by our Operation Isolation team.
But I guess any reservations? I know there's been some debate about whether this is the time to welcome international travelers. How do you feel about it yourself?
Well, I think we certainly know that we've talked about it for a year and a half. When people are traveling, it increases the risk of importation. But I also know that one of the things that PI has done very well in the last year and a half is to make sure that we do testing and identify the people who are coming in from international travel. And so we'll make sure they're fully vaccinated with an approved vaccine in Canada, and that's certainly one of the federal requirements as well. And that we'll do testing as well as screening. So I think the virus is the same whether it's coming in from international or other parts of this country, and we're seeing increasing rates in other parts of the country as well. So it all is potential risk, but we are, I think, mitigating that risk by trying to make sure people are fully vaccinated. Otherwise, they will isolate if they're coming in from outside Atlantic Canada, and that's international or other parts of the country.
The Guardian.
Good afternoon, Dr. Morrison and Premier King. I guess, Dr. Morrison, did I understand you correctly that I know the September 12th date has been part of the plan all along in terms of the public health state of emergency. Did I understand correctly that it's been sort of moved into the mid-October in terms of moving forward to Part 5 of the Moving Forward plan? Did I understand that correctly?
Hi. I think in terms of, we've announced previously that the travel measures in terms of the PI pass and the border measures would remain in place until at least middle of October. And in terms of the September 12th date around the cohorts and gathering limits, that we would not be lifting those on September 12th. But I do think that we'll hear more about what that could look like by October.
Okay, terrific. Thank you. And I guess as a follow-up question, you mentioned the rapid testing kits that have been distributed to parents, I'm assuming. Any idea how many have been distributed and to what age groups?
Well, thank you, because they have been, they were en route on the weekend, and I don't know if the weather held them up, but they were due to arrive on Friday into the province, and they were delayed a little bit. So I think we were hoping this morning to find out if they have landed in the province. But when they are landed, when we get them in our hands, they will be part of a pilot project. And we've ordered in a total of 5,000. We actually would have taken more, but we were able to get 5,000 of these tests. And certainly a few thousand will go into this pilot project for students and parents in particularly our eastern western ends of PI, where they may not be as close to testing clinics if their children have any mild symptoms. So that's the plan, and there'll be certainly a release out and information out through the school system as well later this week once those kits have arrived. And we have the education material and some handouts to go with them as well.
Any specific age groups targeted?
Well, I think we are particularly wanting to focus on children in kindergarten to grade 6 because it's a group who aren't vaccinated, but I don't think there'll be a restriction on that age cohort in particular.
Tremendous. Thank you so much for your time.
You're welcome.
Brian, did you have anything else, or okay?
All good.
That's
Good.
a wrap. So thank you very much, Dr. Morrison. Thank you to our friends in the media and to all Islanders. Have a good day and safe back to school for all families. Thank you very much.